healthier communities. As you can see right now, in 2013 to 2016, this is the first initial bill was filed by Representative Rahel Espina in the 16th Congress. Then refiled during 17th Congress in 2016, and in September 7, 2017, it was approved and transmitted to the Senate, and goes on up to the final legislative action was agreed for both houses in 2018. Next slide, please. Now, the passage of RA 1148 or the Kalusugan at Nutrisyon na Magnanay Act is a conglomerated effort by the champions of the advocacy in both Senate and the House of Representatives, as I mentioned, the Department of Health, the National Nutrition Council, the civil society organizations including UNICEF, PLCP. It is the first comprehensive legislation on the first 1,000 days of life in the Philippines and around the world. While the success of the F1K legislative is a policy campaign, is a landmark of achievement, there's still much to be done in advancing maternal and child nutrition and early child development. Since January 2019, DOH together with the National Nutrition Council has been leading a multi-sectoral technical working group composed of national government agencies, development partners, and CSOs to draft the implementing rules and regulation of RA 1148. The IRR was signed in May 2019, which also identified the need to develop the manual procedures that will be later on presented by DOH. So in terms of the development of the manual procedures, we have done several phases. First phase is the assessment and policy mapping. So we map the existing services and systems vis-a-vis the program components and cross-cutting components stipulated in the RA 1148 and its IRR. And we identified those that still have policy and program gaps and develop recommendations based on available plans and evidences. The next phase will be the fieldwork and data gathering. So the team have conducted FGD, KII, and review processes, and also look at the timelines and mechanism for both nutrition-specific and nutrition-sensitive programs for also both emergency and development contexts. The team also have reviewed and documented the different plans, program, budget, services, and systems, mandated or actual, and tools from the barangay level up to the municipal, city, to the province, and to the regional level. The team also has analyzed the capacity gaps of service providers and identified and documented lessons and good practices to have been used in the development of the manual procedures. Then we have done write-up of the manual procedures and then the job aids. Next slide, please. Just like to present a snapshot of the early wins of the UNICEF in terms of the supported areas that we have been there. So for example, we have been in the 3 provinces in Samar, Northern Samar, Zamboanga del Norte. Currently, we're having a 13 provincial F1KD related policies. And we do have 6 municipal F1KD policies developed. And we have 7 first 1,000 days policies integrated to other programs like the ZOT and Peridec. So these are the early wins of our implementation of the first 1,000 days. That later on, I think Save the Children also will be presenting the early wins in terms of the first 1,000 days. Next slide, please. This is also a snapshot of all other indicators and services that our 3 provinces are providing right now together with our partner, government partners and Zwedig Family Foundation. So we just would like to show you that preventing undernutrition during the first 1,000 days is one of the most cost-effective investment you can make for your children. Every dollar spent or every peso is spent in this intervention can save around around $12 in foregone earnings of our health expenditures due to undernutrition. Addressing undernutrition also requires integrated and timely intervention from multiple sectors. While nutrition is primarily determined by health status, quality of care, and access to food, it's also linked to water, hygiene, sanitation, education, social protection, and livelihood, among others. So I just want to say that shaping a supportive environment for adequate nutrition and growth for children requires an integrated and multi-sector approach. Both nutrition-specific and nutrition-sensitive interventions are necessary to achieve the desired results. So again, next slide, please. Again, thank you very much. You all attending here have helped shape policies, laws, and programs by actually participating actively in discussion around the first 1,000 days. This way, you're doing your part in ensuring adequate nutrition for children and nation building. Again, thank you very much. Salamat po.
Maraming salamat po, Mr. Jefferson Gregorio, ang ating nutrition specialist mula sa UNICEF sa magbibigay ng mga importanteng kaalaman sa pag-aaral sa likod ng pagbuo ng IRR at MOP para sa RA 11148. Ngayon po, aming uulitin ang pag-play ng video ni Undersecretary Rosario Vergere para po mapakinggan natin ang kanyang mensahe. Paumanhin po kanina sa technical na problema sa ating audio. Sila.
Good morning to all the attendees of this event. It is my pleasure to welcome and thank you for attending this event, the Sulong First 1,000 Days launch of the Manual of Procedures on the Implementation of the Republic Act 11148, ang Kalusugan at Nutrisyon na Magnanay Act. The Department of Health recognizes that the first 1,000 days is a delicate and critical period for a child's growth and development. It is an opportunity that should not be missed. Among the key factors in early brain development is the provision of proper nutrition. And every child has the right to obtain optimal nutrition and should be protected from long-term consequences of malnutrition that could affect their future education, profession, mental health, among others, which are eventual costs to the society. This is why we are promoting the first 1,000 day strategy with the development and dissemination of this manual of procedures. This MOP was developed to produce a practical guide for local government units in the reduction of malnutrition, hunger, and stunting through care for our mothers and babies and fostering convergence of health, nutrition, social welfare, and food services in our communities. The Department of Health, together with the National Nutrition Council, the Department of Agriculture, and the Department of Social Welfare and Development, as co-leads in the implementation of the first 1,000 Days Act, recognizes that we are in a critical position in empowering local government units in taking up health and nutrition as priority investments, especially with the Mandanas-Garcia Supreme Court ruling, which increases the value of their 40% share from the national taxes. The first 1,000 Days Act and the MOP proposes that funding, among other acts of governance, should be harmonized to fully support the health and nutrition needs of mothers and children in order to bring about lifelong positive impact not only to individuals but to the community's productivity and economy. We call on our partners, especially our dear friends in the local government units, to now not grow tired of continuous introspection to encourage heightened demand for services, that these services are accessible, and that we are open to sustainable collaborations in the spirit of whole of government approach. We look towards collaborative governance in order to deliver the full range of quality services to Filipinos to support our countrymen in reaching their full potential as citizens. With that, let me thank our partners for the collaborative efforts in the development of the RA 11148 and its MOP, UNICEF Philippines, Save the Children, and our colleagues from the Department of Health, the National Nutrition Council, the Department of Agriculture, DSWD, and all our partner government agencies, local government units, development partners, and the civil society. Maraming salamat po and good morning to all of you.
Salamat po sa panimulang mensahe galing po kay Ating Yusek Reyere. Ngayon po, kasama naman natin ngayong araw na ito si Dr. Vilda Silvia, ang Chief ng Family Health Division under Disease Prevention and Control Bureau at Health upang magbigay ng introduksyon sa Manual of Operations ng Kalusugan at Nutrisyon ng Magnanay Act.
Maraming salamat. Magandang umaga po. Bago po tayo magsimula, flashed on the screen ay ang QR code na magbibigay sa inyo ng access sa first 1,000 days manual of operations. Maaari po ninyong gamitin ang inyong cellphone para ma-access ang MOP o kaya na may puntahan ang web address na naka-flash din po sa inyong mga screen. Magandang umaga pong muli sa ating po si Dr. Maria Wilda Silva ng Family Health Division ng Kagawaran ng Kalusugan. At sa ngalan po ng Department of Health, nais ko pong ipakilala ang RA 11148 o First 1,000 Days MOP sa loob ng 30 minuto. Next slide, please. Noong 2020 hanggang sa unang 21, naglaan ng oras ang Kagawaran ng Kalusugan. Marami po tayong nagtrabaho po dito. Department of Health, National Nutrition Council, Department of Social Welfare and Development, Department of Agriculture at iba't ibang sangay ng national government. Kasama din po natin ang mga lokal na pamahalaan, non-government organizations at CSOs para buuin ang years ng first 1,000 days base sa Republic Act 11148 o ang Kalusugan at Nutrisyon ng Magnanay Act. Sa tulong mula sa pamahalaan ng Republic of Korea through the Korea International Cooperation Agency at UNICEF Philippines na pareho nating laging katuwang pagdating sa pagpapaunlad ng kalusugan at kabuhayan ng mga kababaihan at kabataan. Matagumpay nating natapos ang MOP ng first 1,000 days. Next slide. Susunod na slide po. Okay. This MOP was developed as a reference guide to achieve the main objective of the kalusugan at nutrisyon. Okay. I think slide first. If I can go back to the previous slide. Okay, this MOP was developed as a reference and a guide to achieve the main objective of Kalusugan at Nutrisyon ng Magnanay Act of 2018. And ano po itong objective na ito? To provide comprehensive, sustainable, multi-sectoral strategies and approaches to address health and nutrition problems of newborns, infants, and young children, pregnant and lactating women and adolescent females, as well as multifactorial issues that negatively affect the development of newborns, infants, and young children. So this MOP is to aid is in strengthening the local government unit's integrated strategy to implement the kalusugan at nutrisyon ng Magnanay Act. How? Number one, by outlining steps that LGUs and other stakeholders can take to identify and strengthen their integrated first 1,000 days strategy. Number two, by providing guidance for program planning, implementation, monitoring, and evaluation. Number three, by defining roles and responsibilities per stakeholder and across governance level. And number four, by delineating roles and functions among frontline workers. An important note, while RA 11148 limits the age group coverage up to 24 months, our target are the 0 to 24-month-old. But there is a wisdom to extend the concern to include those beyond 24 months, like the 25 to 35-month-old children, to ensure that they are looked after and to be consistent with the nurturing care framework. Thus, this document will use first 1,000 days plus to refer to those in the first 1,000 days plus the 24 to 35-month-old children in that age group. Next. Okay, the MOP is primarily for the direct implementing level, the barangay, the city, the municipality levels, and program managers and service providers in health, nutrition, social welfare, staff in the rural health unit, nutrition office, social welfare office, barangay health workers, barangay nutrition scholars, and child development workers. It is also for the members of the provincial, city, municipal, and barangay nutrition committees, as well as national government agencies, non-government organizations, and development partners to enable them to undertake effectively, especially along supporting the direct implementing levels of the kalusugan at nutrisyon ng Magnanay Act of 2018. So para saan ang MOP na ito? Para sa ating lahat na tagapag-alaga ng kalusugan at nutrisyon ng Magnanay. Next. Next slide, please. Okay, so how is the MOP structured? The MOP is divided into five parts. Part 1, overview of the Kalusugan at Nutrisyon ng Magnanay Act, highlighting its objectives. Part 2 is support for integration that gives an overview of the nurturing care framework. Also, this section presents challenges in integration and defines the components of integration. Part 3, how the RA 11148 can be implemented by the local government unit at the city, municipal level up to. Part 4 outlines the roles and functions of key players in each of the administrative levels and how other levels like the provinces, the region, and the national can support the key players at the local level. And part 5, information resources for implementing RA 11148, list related policy issuances and references for actualizing RA 11148. Next, please. Next slide. So the MOP clarifies the link of the nurturing care framework to the first 1,000 days strategy. The 5 components of the nurturing care are good health, adequate nutrition, caregiving, opportunities for early learning, and number 5, security and safety. These components interact with each other. For instance, responsive caregiving helps a caregiver recognize and responds to clues or cues that a child is hungry. And feeding the child is important to ensure that she gets the nutrients needed for growth and development. Breastfeeding as well is very important. While primarily done to provide nourishment, this also allows eye contact and touch between the mother and the child that helps in strengthening their bond, giving the infant a sense of security. Breastfeeding sessions are also opportunities to sing and talk to the infant, which stimulates the infant's sense of hearing. On the other hand, a child who is physically and emotionally abused may not have the appetite to eat well, compromising her nutritional needs. And the same abused child may also be unresponsive to the environment and experience delays in the different domains of child development. So a neglected child may not be brought to the health facility for immunization, and this makes the child susceptible to other diseases. Next slide. The next slide is the first 1,000-day service delivery frame. So ano po itong nilalaman ng frame na to? Napakarami pong nilalaman ng slide na to, pero in a nutshell, ang laman nito ay ang pangangalaga, mga programa patungkol sa pangangalaga ng nanay habang nagbubuntis hanggang makapanganak at pangangalaga ng sanggol hanggang 2 taong gulang. Subalit, sabi ko nga po kanina, may wisdom na kailangang ituloy. Sa lampas ng 2 taon ang ating mga programa sa nutrisyon to ensure that our children develop well. Next slide. The next slide will talk about challenges in integrated service delivery for the first 1,000 days. So most of the program components or services in the RA 11148 are already existing programs implemented at varying levels of coverage and quality. However, there is a need to calibrate or recalibrate and implement these existing programs in an integrated and holistic manner. In this regard, integrated service delivery is defined as the organization and management of services in health, nutrition, social development, and other related sectors so that those in the first 1,000 days get the care they need, when they need it, in ways that are user-friendly, we achieve the desired result, and provide value for money. Nakalista po dito ang mga challenges that hinder integrated services. And makikita natin dito, these are missing services, for example. Number 2, several parenting support interventions pero limited coordination and harmonization. We also experience limited funding for first 1,000 days plus related services and programs, especially at the local level. Monitoring child development, especially for the first 1,000 days, sometimes this is a challenge because of competing priorities. Inequity in the delivery of first 1,000 days. Mga mayayamang local government units na may mga pondo nakakapagbigay ng mas maraming serbisyo. sa mas maraming nasasakupan compared to those who belong to the lower class municipalities or cities. And another thing is effectiveness of the coordinative structures for planning, financing, and implementation of holistic integrated ECCD services. So ilan lang po ito sa mga challenges na kailangan nating bunuin para mapagtagumpay ating suliranin sa nutrisyon. Next slide. Okay. A first step to implementing RA 11148 is assessing the first 1,000 day situation. Nabanggit po ito kanina. This involves having shared view on issues affecting children, causes of these issues, and priority actions, and priority actions that should be pursued. And this situational analysis can also look into good practices in service delivery, good practices in capacity building, management and coordination, and other concerns, and feed into the identification of service integration, strengthening of planning and budgeting for health, nutrition, strengthening of service delivery, strengthening of monitoring and evaluation, and creating a whole of government action, which means collaborative approach to health and nutrition governance to ensure that the full range of the first 1,000 days, including social protection, food security, are accessible to mothers, children, and the entire family. Next slide. Next slide, please. Okay. At the barangay level, the MOP provides further guidance for barangay to organize first 1,000 days plus response in their communities through the Barangay Nutrition Committee, with services rendered through the barangay health station and provided by the frontline workers. The this MOP reiterates of these structures. The barangay is very important, and the Barangay Nutrition Committee is tasked to provide and are provided specific guidelines here in this MOP with the formulation of the Barangay Nutrition Action Plan that should include all related services stated in the RA 11148. There are no guidelines for barangay nutrition planning. The guidelines for city or municipal nutrition action plan can be adapted to the situation of the barangay. Okay. So this includes also the monitoring of the Barangay Nutrition Action Plan, coordination of the Barangay Nutrition Action Plan implementation, and coordination with other groups in the barangay to facilitate the delivery of complementary services. Next. Next slide, please. So the next slide will be, okay, the frontline health workers. There are three main frontline workers involved in the delivery of the first 1,000 days. The barangay nutrition scholars, who are the trained community workers who voluntarily render nutrition services and other related activities in the barangay. And we reiterate that there should be at least one BNS per barangay. The barangay health worker. This is also a trained community worker who voluntarily renders primary health care services and other related activities in the community. There should be a one barangay health worker for every 25 household. And yung pangatlo po na main frontline worker, child care worker in child development centers. And sino sila? A community worker trained to provide supplemental parental care and early childhood enrichment activities to ensure that physical, cognitive, social, and emotional needs of children are being addressed. So the MOPR provides for the activities that these frontline workers in the context of the first 1,000 days. Next slide, please. Okay, so city and municipality. In the cities and municipalities, the city or the municipal mayor provides leadership and guidance in the implementation of the first 1,000 days or the RA 11148. So napakalaki po ng katungkulan na gagampanan ng ating mga leader sa lokal na pamahalaan patungkol sa first 1,000 days. He ensures that all department and offices in the city or municipality identify, pursue, and report on their specific accountabilities in implementing the law. The local chief executives also ensure that funds, importante, pondo, for the first 1,000 days plus services and activities are not only available but actually released and used in the most efficient and effective way para sa kalusugan ng nanay at ng sanggol. Now, the city municipal health office shall be the lead in the delivery of individual and population-based services in the first 1,000 days, being a sector that has the most contact with the population group covered by the first 1,000 days. And as such, the city or the municipal health officer has the responsibility and accountability in ensuring that the city or the municipal health office undertakes its roles efficiently and effectively. Next slide. Okay. Next slide, please. So here is the sectoral involvement in the first 1,000 days at the city and municipal level. Makikita natin to. LGU office, Sangguniang Bayan. What are the sample actions for involvement or commitment of each of these sectors? So, Sangguniang Bayan, for example, can enact ordinances related to first 1,000 days. Example, localization of the first 1,000 days act. Comprehensive nutrition action in the city or municipal level. And they can also ensure that approved local budgets have provisions for first 1,000 days. Agriculture and fisheries. Nakalagay din po dito ang mga sample actions for involvement. Example, support farmers and fisher folk with wives who are pregnant or lactating and children 0 to 35-month-old to improve productivity and incomes. Example, financing, agriculture inputs, technology transfer, improve irrigation, fish nets, fishing boats, etc. So, related to employment, what are the sample actions? Identify employment opportunities for members of household with members in the first 1,000 days. Engineering also has a role. Planning and development has a big role, and DRRMO as well. Okay, if I can have the next slide. Next slide, please. At the provincial level. Okay. At the province level, for the offices, so meron tayong mga inilista na maaaring gawin at kailangang gawin ng ating provincial health office. For example, we organize the provincial WHS or the HPCN in the province. Ensure that services related to the first 1,000 days are integrated in program packages and the like. So for the provincial nutrition office, there are major roles expected and are furthered by local assignments. Example, advise the Provincial Nutrition Committee on nutrition program matters. Napaka-importante po itong role ng ating Provincial Nutrition Office. Another, coordination of the Provincial Health Office, cities and municipalities, they should coordinate and coordinate the conduct of the first 1,000 day situational analysis. The Provincial Nutrition Office also shall coordinate the formulation of the Provincial Nutrition Action Plan and the integration concerns in the Provincial Physical Framework and Development Plan, and coordinate the formulation of a Provincial Nutrition in Emergencies Plan and its integration in the Provincial DRRM Health Plan. And another is monitor and evaluate the Provincial Nutrition Plan, including the integrated delivery of the first 1,000 days plus services. So other LGU departments and offices should integrate the first 1,000 days plus concern in their respective programs and projects. So ang keyword po dito is integration of the first 1,000 days. Next. Next slide, please. Okay. So the MOP requires the provision of delineation of roles of the barangay nutrition committees, health and nutrition offices at the LGU, and secondary and tertiary levels of care and local social welfare and development, and the specific roles of the barangay health workers, barangay nutrition scholars, and child development workers in carrying out the services under the first 1,000 days. Delineation of function is very important, as in some cases, conflicts have arisen between the nutrition office and the health office. Prevented by clear delineation of responsibilities and accountabilities. So when delineation may not be as obvious, the best option is to do a dialogue, negotiate and agree, and pursue agreements. And in the final run, the rule should always be eyes on the ball. The ball is ensuring the service delivery of the first 1,000 days services. Next slide. So it also includes, okay, next slide, please. This MOP also includes the roles of multi-sectoral agencies beyond health, beyond nutrition, social welfare and development. So this includes the Sangguniang Bayan, agriculture, fisheries sector, labor sector, engineering, planning and development, and disaster risk reduction. So lahat po tayo magkakatuwang to ensure that the kalusugan ng Magnanay Act will be implemented. National agency roles are also defined in the MOP from the National Nutrition Council, DOH, DILG, DAR, and also other partners in the development sector, civil society and non-government sector, and also the academe. So maganda po yung MOP dahil lahat po ng ating mga gagawin ay magkakatuwang or magkakatahi, no, to ensure that the Kalusugan na Magnanay Act will be implemented. Next slide. Next slide, please. In the RA 11148, okay, Section 12 stipulates that the DOH and the NNC, in coordination with the LGU, shall provide practical and effective training courses to BNSS, DHWs, CDWs, and other personnel concerned to upgrade their skills and competence in the implementation of services and interventions for the health and nutrition of women and children. So, in the MOP, there are lists of areas of concern to be covered by capacity building. There are around 13 of them, and I will not mention them here one by one. But example of capacity building is effective delivery of antenatal care, essential maternal and newborn care, and lactation management. That is one of the capacities that we need to for our frontline health workers. Next. So the first 1,000 days manual of procedure in supporting the activities for adopting the first 1,000 days, in LGU, the MOP provides the following. Tatlo po, guidance on situational analysis, planning, implementation, M&E, and advocacy, templates, ordinances, first 1,000 days service programming. So may mga kasama na pong sample ordinances if our LGUs would like to adopt. And information resource, national policies, and sample local ordinances. Next slide. So I guess this is the end of my presentation. So for the first 1,000, sana po ay magtulong-tulungan po tayo. Matagal na pong scourge ng society ang malnutrition, particularly ang stunting, at dito po sa pagpapatupad ng first 1,000 days or kalusugan ng magnanay, where the entry point are the pregnant, mapapangalagaan natin ang kalusugan habang ang sanggol ay nasa sinapupunan pa lamang. At masusubaybayan natin hanggang siya ay lumaki, magkaroon ng tsansang mabuhay ng malusog, at maging responsible at malaki ang maiaambag sa ating lipunan. So, first 1,000 days, this is the manual of procedure for all of us na meron pong pakialam sa nutrisyon at kalusugan ng magnanay. Maraming salamat po at maganda at malusog na umagang muli sa ating lahat. Over to you.
Gilda Silvia, maraming salamat po sa pagpapaunlak sa aming lahat at sa pagpapakilala ng lubos sa Manual of Procedures for the first 1,000 days strategy ng RA 11148. Kayo naman po para magbigay ng mensahe patungkol sa pagpapatupad ng first 1,000 days MOPR ay magmumula sa pinuno ng kabinete o ang Office of the Cabinet Secretary na siya din Country Advisor on Skilling of Nutrition or SON, Philippines. Let us all welcome Cabinet Secretary Carlo Alexei Nograles.
Maraming salamat po. Magandang umaga po sa ating lahat, lalong-lalo na kay DOH Secretary Francisco Duque III, represented by Undersecretary Maria Rosario Vergere, Senator Risa Hontiveros, NNC Executive Director, Assistant Secretary Azucena Apet Daenghirang, UNICEF Philippines Deputy Representative Bezad Nubari, UNICEF Philippines Nutrition Manager Alice Nkoroy, UNICEF Philippines Nutrition Specialist Jefferson Gregorio, Save the Children Philippines Advocacy Manager, Attorney Emma Salmani. Save the Children Philippines Health and Nutrition Advisor, Dr. Amado Parawan. DOH Director Beverly Ho. DOH Dr. Maria Wilda Silva. Sa ating pong lahat, magandang umaga po muli. I salute and thank the Department of Health and the National Nutrition Council, as well as the United Nations Children's Fund, the World Health Organization, Save the Children Incorporated, and other development partners for jointly developing the Manual of Procedures to Republic Act 11148, or the Kalusugan at Nutrition ng Magnanay Act, also known as the First 1,000 Days Law. We continue to work hard for our goal of achieving zero hunger and to ensure that all Filipinos are nourished and healthy. Since the start of this administration, the goals and objectives in human capital development by this administration, the goals and objectives in human capital development by reducing inequalities in the Filipinos' ability to stay healthy and be well nourished has been specified and detailed in the Philippine Development Plan 2017 to 2022. To supplement the PDP and to further provide the country's framework of action for nutrition improvement, the Philippine Plan of Action for Nutrition 2017 to 2022 was finalized and continues to be implemented. PIPAN laid out the government's targets, directions, and priority actions to address wasting, stunting, micronutrient deficiencies, overweight, and obesity. Benchmark laws such as the Republic Act 11148 or the First 1,000 Days Act and Republic Act 11037 or Masustansyang Pagkain para sa Batang Pilipino Act have also been promulgated to ensure that even beyond the present administration's term, the needed programs for improved nutrition will continue to be supported. Aligned with the First 1,000 Days Law, we are also able to pilot the Tutok Kainan National Dietary Supplementation Program, our complementary feeding program for nutritionally at-risk pregnant women and children age 6 months to 23 months old. Now, to ensure continuity, these plans, policies, and programs are all embedded in our national food policy. Our blueprint that outlines the priorities of government to end hunger, improve nutrition, and promote sustainable agriculture. The roadmap for achieving zero hunger. Policies and interventions are already in place. And today's initiative is most welcome to further assist our partners to engage with us and foster a genuine whole of government, whole of nation, and whole of society approach in providing support to our kababayans, nourishing them, to allow all Filipinos and Filipinas the ability to reach their full potential. This manual of procedures was developed as a guide to achieve the main objective of the Kalusugan at Nutrition ng Magnanay Act, to provide comprehensive, sustainable, multi-sectoral strategies and approaches to address health and nutrition problems for the first 1,000 days of life through the help of our local government units, our program implementers, and of course, our frontline workers. So I encourage everyone to utilize this manual and help us work better together in providing the necessary services for the first 1,000 days of life and ensure that mothers, their babies, their children are at optimum health at this crucial and most important period in their lives. Maraming salamat po at mag-ingat po tayo parati.
Salamat, Cabinet Secretary Nograles, para sa strategic messages for implementation of MOPR. Ang susunod naman pong mensahe ay magmumula sa author ng RA 1148, Chair on Women, Children, Family Relations, and Gender Equality Committee. Walang iba kundi si Senator Risa Ontiveros Barraquel. Atin pong pakinggan ang kanyang mensahe.
Good day, everyone. First and foremost, I'd like to commend the Department of Health as well as the National Nutrition Council for the successful launch of the new Manual of Operations for our Kalusugan at Nutrisyon ng Magnanay Act. Thank you also to UNICEF and the Korean International Cooperation Agency for working jointly and providing us support. The pandemic has posed serious threats to food security and nutrition, and with the completion of this reference guide for LGUs, it will aid our local leaders in identifying appropriate programs and measures to ensure good maternal and child nutritional practices. When I sponsored and co-authored this law, I already envisioned a community working together towards mitigating hunger, upholding above everything else the health and wellness of Filipino children. Kailangan natin ng mga ganitong collab, lalo na ngayong marami ang nagugutom dahil nabawasan o nawalan ng kita. Investing in better nutrition in the first 1,000 days is investing in our nation's future. Let's continue to work together, all hands on deck, so that no child will be deprived of his or her right to nutrition ever again. Thank you very much. Stay safe and stay healthy.
Salamat po sa mensahe ito mula kay Senator Risa Ontiveros. Para naman po sa pagbibigay alam ng Save the Children's First 1,000 Days Project Strategy in Hong Kong, welcome po kay Attorney Emma Salmani, ang Advocacy Manager of the Save the Children Philippines, at kay Dr. Amado Parawan, ang Health and Nutrition Advisor ng Save the Children Philippines.
Hello, good morning sa lahat ng nag-attend sa launching ng first 1,000 Days Manual of Procedures. First, I would like to thank the DOH, NNC, UNICEF for inviting Save the Children Philippines so that we can share with you our approach to the Save 1,000 Days, for the Save the Children's program on the first 1,000 days. Next slide, please. So I will be presenting together with our advocacy manager, Attorney Emma Salmani, because we worked together when the first 1,000 days law was drafted and passed at the Congress, including the implementing rules and regulations, as well as being a member of the technical working group that drafted this manual of procedures. Next slide, please. My presentation, next slide. My presentation this presentation will cover 5 key points. No, I will be discussing the first 4, and then Attorney Emma Salmani will share with you the lessons that we learned when we implemented the first 1,000 days. No? Bago siguro ako mag-start, siguro I would like to share that this is a very new law. No? So it is expected that we encounter a lot of challenges, and then it will take time for the law to take off, especially if we're going to implement it on the ground. So parang dahan-dahan lang yung pag-implement natin ng first 1,000 days sa mga barangay, and then we will also share with you how it can be integrated with other sectors. No? So next slide, please. I would like to share with you the background how we really thought of really doing first 1,000 days. No, I think you can remember that in 2013, the Lancet came up already with the first 1,000 days concept based on their studies that the first 1,000 days is really the window of opportunity. It was in 2013 that Lancet already came up with a framework looking at the nutrition-specific interventions as well as the nutrition-sensitive, nutrition-sensitive approaches and programs. So kami sa Save the Children, they gave us an idea of really starting the first 1,000 days in our Manchan, Maternal, Newborn, and Child Health and Nutrition program. No? But we wanted to pilot it muna. No? So we were very lucky that in 2015, we got funding from Johnson & Johnson to pilot the first 1,000 days in Caloocan City, selected barangays in Caloocan City. In fact, we got funding from Johnson & Johnson for the next 5 years to really focus on first 1,000 days. No? So in 2016, we started the advocacy on the first 1,000 days law, working with NNC and the DOH. And then also in 2017, we thought of applying the World Health Organization's 6 building blocks of health systems to approach first 1,000 days using the systems approach. Then we also thought of, because the nurturing care framework was new at the time, so we thought of also incorporating the nurturing care framework into the first 1,000 days for our Manchan programs. So in 2018, we started already the advocacy for the passage of local first 1,000 days ordinances in Save the Children Philippines program areas. So this is in National Capital Region, the cities of Caloocan, Malabon, and Navotas, as well as in 2 municipalities in North Cotabato and 2 municipalities in Sarangani. Next slide. Okay, in 2019, we developed the F1KD law localization guide to really help the LGUs, on how to localize this particular law and guide them on how do you apply the nurturing care framework, how do you look at the systems approach. So we really introduced the 6 building blocks of the World Health Organization. Then in 2020, we were we went to Region 8. This is particularly in the municipality of Villarreal, Samar, to really model first 1,000 days focus Manchan with other components like social protection. We also looked at introducing SBCC, social and behavior change communication, which I will explain later. So in our other projects, we also integrated first 1,000 days, Kasi yung first 1,000 days kasi pwedeng entry point yan. If you have projects in WASH, now in COVID, also we have another project looking at intrapartum care and also ECCD. These are really opportunities to really integrate first 1,000 days, And last September 30, we just launched our hunger and malnutrition campaign, which will also focus on first 1,000 days. We will be using the digital as well as community-based platform. Next slide. So in our program areas, this is like what we did. So this particular slide will show you how we synchronize the localization of the first 1,000 days law. So we started with really doing a situational analysis looking at the child rights, no? Because if we're going to do first 1,000 days, we have to the handle or the umbrella, no, law of the umbrella principle would be the Convention of the Rights of the Child, of the United Nations. So being a child rights based organization, we have to look do a situational analysis. So we synchronized what was happening at the national level and also at the local level. So making sure that the LGUs are updated as well as capacitated on, again, not only in the first 1,000 days, but the importance of the building blocks, the nurturing care framework, as well as making sure that other sectors are involved. Kasi yung first 1,000 days kasi hindi lang talaga siya sa nutrition. Ano? Kasi you cannot solve nutrition problems if you do not involve other sectors. So this is the time, this is really the opportunity, a very good opportunity to get all the players together, no? From sector, private sector. So we really modeled this in Save the Children program areas in Kamanaba, in Caloocan, Malabon, and Nabotas, now in Villarreal, and then we're expanding to 2 new municipalities, Calbiga and Yabong, and then also in Mindanao. But also making sure that if we're doing ECCD, we're making it a point that first 1,000 days should really be a key component of ECCD. No? Next slide. Okay, yung nurturing care framework kasi ito is really highlighted in the implementing rules and regulations of RA 11148. Now, this is a very new concept, no? Because it does not only look at nutrition, but it looks at health. So if you can, if you know the 5 key components of nurturing care framework, which is health, nutrition, adequate nutrition, safety and security, opportunities for early learning as well as responsive caregiving. Ang ginawa namin sa Save the Children, translate namin siya sa Tagalog, no, para madali ma-pick up at saka maintindihan at saka ma-recall ng mga partners namin. So we came up with the Kalinga as an acronym. So K for kalusugan, A for agang pagtuturo, then L ay ligtas at seguridad and nutrition, and GA na aruga. So talagang swak siya dun sa first 1,000 days na talagang batas na sinasabi nurturing care framework talagang gagamitin natin. Kasi nandun yun sa IRR eh. So talagang ituturo natin, we have to capacitate our partners on what is the nurturing care framework. So as you can see, it's not only talaga nutrition. Because the problem of malnutrition is multifactorial. No? So this is where the nurturing care framework is very crucial. Next slide. So I will be presenting some of our strategies. So next slide, please. Okay, ito yung dinevelop namin. With funding from Johnson & Johnson, we were able, the previous slide, we were able to develop like a tracker on the first 1,000 days to get it has a video, no, that really shows. So tung 2016, meron na kaming tracker on the first 1,000 days na we shared with our LGU. So ito yung video na pinapakita sa mga health center. On the first 1,000 days. So again, yung makikita nyo ng mga photos dyan, ito yung mga talagang yung mga beneficiaries namin, yung mga clients that benefited from our first 1,000 days focus month-end program. So makikita natin doon sa aming tracker, meron na siyang ECCD, meron na siyang WASH, meron na siyang like protection. So doon talaga dahan-dahan talaga i-introduce yung nurturing care framework. Kasi it's a very new concept that our partners should be capacitated. Next slide, please. We also developed, next slide. We also developed prototypes, SPCC prototypes, which we have field tested in Villarreal, Samar, no? So alam naman natin that malnutrition, especially stunting, starts during pregnancy. So yung mga pregnant women should know their body mass index. Doon tayo nagkakaproblema, hindi nila alam yung kanilang nutritional status. We developed this Andy BMI calculator, and also of course with other like UNICEF, and then also I think World Vision is also doing it, yung family-led MUAC. We also develop a child length mat. Ito yung from 6 months to 2 years old, pahigain mo lang yung bata dun sa mat. Makikita mo ngayon kung stunted ba. So malalaman na ng nanay kung stunted ba yung bata. And again, magkaroon ng behavior yung nanay to do something. Kung stunted yung anak niya, pakainin or i-deworm ba. So these are prototypes, SBCC prototypes that we have field tested. We have field tested in Villarreal, Samar. So we're very excited to share these prototypes so that mothers can really visualize. No? Ang mahirap kasi kung mga numero lang ibigay natin sa mga nanay, hindi nila ma-visualize yung sitwasyon, no? So kung stunted ba yung kanilang anak. So this is one prototype that we are doing and also undergoing talagang field testing. Next slide, please. Okay. There is a great need to really capacitate, no, our F1. You have to identify F1 KD champions, and they have to be capacitated, no. So talagang you go through them kasi some of them really have to be introduced on dati nutrition sensitive, ano yung nutrition specific, tapos ano yung mga other sectors coming in, ano ang role niya. So this is again based on RA 11148 and its implementing rules and regulations. There is capacity building or capacity development is really very crucial if we want to implement the RA 11148. Next slide. The next strategy that we did is really advocacy. Okay, so at the national level, we were able to come up with 3 local researches na na-pick up ng media, pinick up din ng ibang LGUs. In fact, NEDA is also using one of our research on the problem of stunting and also the need for a law. No? So, shinare din namin dun sa Congress yung mga experience namin on first 1,000 days. Kailangan talaga may commitment or saka political will ang mga local chief executives, no, mga mayor, SB ng health. Kung merong training, kung pwede maka-attend sila, much better, no? Kasi importante talaga yung kanilang leadership. When it comes to nutrition governance, it's really the LGUs will push it, no? At saka diretso-diretso na yun. Kung merong governance and leadership, hahanapan na nila ng pondo based on the data that you present. Kasi yung mga LGU kasi or mga LCE, they need justification. Bakit gagawin natin to? So talagang kailangan makita yung mga datos ng prioritization. Hindi kasi siya pwede blanket, no? You have to prioritize areas, no, kung saan mas nangangailangan. And lastly, sa advocacy, multi-sectoral talaga yan, no? Hindi pwede puro lang ng mga taga-nutrition ng mga nandun, no? Dapat nandun taga-agriculture, nandun ang mga taga-social DSWD, yung PESO, nandun din yung taga-DILG, even SK, you have to get SK to come in, no? So it's really multi-sectoral, multi-sector. Next slide. Another entry point that we did was really look at nutrition governance in emergencies, no? And then also in humanitarian response. This is what we did in Bicol, Region 5, in the areas of Naga City, Tiwi Albay, and Catanduanes, especially in talaga severely affected doon ng Super Typhoon Rolly. Kasi alam natin, doon nag-landfall yung Typhoon Rolly eh. Grabe ang damage. So, when Save the Children went to Bicol to deliver humanitarian response, we saw at the point that it was a good opportunity also to look at, to go back, alam ba yung nutrition in emergencies in these areas, no? So pinasukan na rin namin ng nutrition governance, no? So kasi sayang eh, kasi part dun sa pag-respond mo at saka yung towards early recovery at saka maging normalized ng mga LGU, papasukan mo na siya ngayon nung mga like a local ordinance. So this is what we did, no, in Bicol. So we were able to conduct basic trainings on concepts, nutrition care framework. We did nutrition emergencies. At saka yung tuturuan mo talaga sila yung advocacy process, no? Kung paano gagawa nung ordinance na talaga tugma dun sa mga problema. So we were able to come up with mga ordinances for the province of Catanduanes, Naga City, municipality Bato and San Andres, and then the municipality of Tiwi. We also parang as an incentive, nagtayo kami ng TLCs, no? Training and Learning Centers, no? Kasi importante kasi yung capacity ng mga LGUs at saka partners. Doon sila matututo kung what is really first 1,000 days. So we were able to identify like a room in the nutrition office, or doon sa Kapitolyo ng Catanduanes, nagtayo kami doon ng TLC. Tapos, of course, Save the Children help in donating like equipment para din matulungan sila. Like we donated laptop, printer, photocopying machine, projector, at saka mga reference materials para talaga ma-share nila. No? So, our strategy here is modeling these areas in Bicol will be the models for scaling up, no? First 1,000 days. So itong picture na to, ito yung wall marker ng 3 TLCs na ginawa namin. As you can see, it's a venue of promoting RA 11148. So doon sila mag-meeting, doon sila mag-workshop, doon sila maggagawa ng mga online ba yan, ng mga webinar. So ito yung isa na gagawa namin as part of the emergency or humanitarian response, no? Next slide. I think Arnold, the next slide will be presented by Attorney Emma Salmani. Siya yung partner ko when we did this first 1,000 days like sa ordinances, and then also making sure that LGUs really may buy-in yung LGU doon sa RA 11148. Emma?
Good morning, everyone, and allow me to continue the presentation for Save the Children Philippines. I will tackle now the lessons that we have learned in the course of our implementation of the first 1,000 days program through our Manchan projects. So we did a pilot, as Dr. Parawan has shared with you, in Caloocan. So that this pilot Manchan project in Caloocan provided us with opportunities to contextualize materials and interventions. The first 1,000 days program strategy cannot be done through a cookie cutter approach. Prevailing conditions in the area should be considered so that appropriate interventions can be provided to our beneficiaries. We also did an in-depth session on WHO's 6 building blocks for health system and nurturing care framework, and provided inputs for a systems-based approach and multi-sectoral programming. This is very important for sustainability because it's the interventions should not be provided only by government. It should be complemented by parents, by caregivers, and by guardians, because parents are those who are in close contact with our children almost every day, every minute of their waking hours. We also did researches, as mentioned by Doc Mads. We did 3 researches. The number one is the stunting and malnutrition, which focuses on the effects of inadequate nutrition during the first 1,000 days of life of a child. The next research was the cause of hunger and malnutrition, which focuses on how much we are losing because we failed to provide sufficient intervention to children so that they can develop and live beyond 5 years of age. Then the next research that we did was lives cut short. This is the impact of malnutrition on the mortality of children. So in this research, it was shown that children who are malnourished are most likely to die before they reach age 5 than those who are well nourished, and the impact of poverty in the area on how we provide sufficient nourishment to our children. We also did campaigns. In 2015, we launched the Lahat Dapat campaign. No child should be left behind. And the proceeds of this campaign was used to fund our programs on malnutrition in our impact areas. The campaign, the researchers also provided us with the needed materials to support our advocacies at the national level for the passage of the first 1,000-day law, the Republic Act 11148, and the local ordinances at the local level. Next slide, please. We also learned that it is very important to identify local champions in the LGUs who can support the passage for an enabling policy environment, the provisions for resources, integration of the first 1,000-day strategy in the local plans and programs. It is also very important here that before you get champions, this champion should be well informed on why we are doing this strategy, so that if we get commitment, it will not just be a verbal commitment, but it is a commitment. It is an informed commitment to support the first 1,000 days strategy, meaning that they will do everything that they can do to make sure that the programs are resourced and implemented for the benefit of the children, pregnant and lactating mothers. We also learned that how important is the availability of local data to design appropriate and contextualized first 1,000 days interventions, especially in times of emergency. It is not enough that you have the data on how many children are malnourished in your area. It is important that you know where they are and the extent of the problem, so that appropriate interventions to address their specific needs can be provided. It is also very important to have a conducive policy environment for our program implementation, and the need for continued technical assistance to ensure that the quality of our F1KD programming and resourcing are maintained. Next slide, please. It is also important that gender, resilience, and inclusivity as cross-cutting themes are integrated into our F1KD programming. We also found out how important partnership is to address F1KD gaps and mobilize resources. Not all LGUs are blessed like our big LGUs like Makati, Quezon City, Pasig, who are awash with resources to devote to their first 1,000 days programs. This partnership with the private sectors, with other government agencies, even with individual professionals, especially in the GIDA areas, can help our LGUs who are experiencing lack in resources to complement what they have, so that the interventions identified for our children are continued and provided for. It is also important to consider the participation of children through their parents, guardians, and caregivers for the sustainability of our F1KD interventions. As I have mentioned earlier, they are the ones who are in close contact with our children, and provisions for their feeding can be taken care of. Provisions for their safety and security, for their early stimulation, can be taken care of by the parents with the help of our community workers. Next slide, please. Oh, that is all, and thank you for giving us the opportunity to share our experiences and our lessons learned in the implementation of the first 1,000 days strategy in Save the Children Philippines. Thank you so much.
Thank you so much, Attorney Emma. And hello, Doc Mads. Thank you so much for sharing. Save the Children Philippines, just like UNICEF, also World Vision, and a lot other development organizations are part of the technical working group, the now defunct technical working group for the development of the implementing rules, and also the MOP for RA 11148, or the first 1,000 day strategy. We hope that you are still with us. Magandang umaga po sa inyong lahat. Ako po si Aya Escobar mula po sa Department of Health, and I would like to gently ease everyone into the panel discussion. So for our tech team, maybe we can open our chat box, and for our participants who were patient enough to join us in this platform, please show your hearts, reactions. How are you feeling right now? Paki-press po dun sa ating reactions button sa baba. Okay, so for our next segment, this will be a panel discussion, and we are honored by our panelists today. We have 4 organizations who will be joining us, and this is actually a very good opportunity for us to share, for us to listen sa kanilang mga insights pagdating sa implementation ng health and nutrition, especially the integration of first 1,000 days sa ating national and local systems. First, we have our one of the pillars of nutrition mula sa Department of Health, representing Undersecretary Maria Rosario Silverhere and Director Beverly Lorraine Ho. We have here with us Ms. Luz B. Tagunicar. She is a Supervising Health Program Officer and is part of the Policy and Technical Standards team for the Family Health Division. Ms. Luz, if you can say hi, we would love to see you on camera. Hi, ma'am.
Hello, good morning, everyone.
And from the National Nutrition Council, we have Dr. Marivic S. Samson. She is part of the Nutrition Planning and Policy Division and is representing our esteemed Assistant Secretary and Executive Director 3, Dr. Azizena M. Dayanghira. Dr. Samson, if you can turn on your camera and say hi to everyone, we would love to see you. And while we're waiting for Dr. Samson, we are very, very fortunate that we have Cabinet Secretary Carlo Alexei B. Nograles giving us some of his very precious time. Sir, we are so lucky to have you join us in this panel discussion. As Cabinet Secretary Nograles, by the way, he's not just our Cabinet Secretary, but he's also the chairperson of the Interagency Task Force for Zero Hunger, and also the country advisor for scaling up nutrition for the Philippines. Hi, sir. Thank you so much for joining us.
Thank you for the opportunity. Magandang umaga po muli.
Good morning, sir. And from the Department of Social Welfare and Development, we have here with us Ms. Cheryl P. Maynar, representing Director Wilma Naviamos of the Program Management Bureau. She is the head of the Children and Youth Unit of the Program Management Bureau. Ms. Cheryl, if you're here. Okay, so while we're waiting for Dr. Samson and Ms. Cheryl, I would like to request all the panelists to turn on their cameras so that our participants could see us. before we start, as we start the panel discussion. Ms. Luz, if you're already there, maybe I could just start with the question para po sa Department of Health. Ms. Luz? Hi, ma'am, you're here.
Yes, I am.
I'm so sorry, ma'am. I'm shifting between windows, but let's start po with the panel discussion with the Department of Health, of course. So ang Department of Health po kasama palagi ang National Nutrition Council at ang napakarami pa pong national government agencies. Nangunguna po tayo sa pag-i-implement ng First 1,000 Days Strategy. Pero mayroon din po tayong batas na naipasa matapos ang 11148. Ito naman po ang ating batas na 11123 or ang Universal Healthcare Law. Paano po na-factor in? Paano po ang applicability ng First 1,000 Days Strategy sa implementation po ng Universal Healthcare Act, lalong-lalo na po sa ating local government units? At ano po dapat yung may aasahan ng ating mga LGUs sa implementation na to sa pakikipagtrabaho kasama ang DOH at ang iba't iba po sa ngayon ng gobyerno sa implementation ng mga batas na ito?
Salamat, Aya, sa napakahabang question na yun. Anyway, bago ko sagutin po yan, gusto ko lang batiin ang mga taga-Department of Health and NNC na nag-organize nitong forum na to, launch ng MOP. Ganon din yung mga development partners natin, UNICEF, WHO, Save the Children, World Vision, and other partner agencies. At syempre, gusto ko ding batiin lahat ng nakapasok dito sa launch na to, no? So nakikita ko sa chat box, maraming local government units sa iba't ibang panig ng bansa. So magandang umaga po sa inyong lahat. So sa katanungan ni Aya na napakahaba, paano ba ito mai-implement sa Department of Health at anong magiging relasyon ng Department of Health sa local government unit sa pagpapatupad nito? So una, bagamat nasabi mo nga na naunang na isabatas ang First 1,000 Days, ang First 1,000 Days Law at ang Universal Healthcare Law ay parehong nakatungtong sa magkaparehong principles. So ang una is integration. So parehong batas ay nagsasabi na kailangan ay may integrated services para maging epektibo at maging mas effective ang mga serbisyong ito. Ang pangalawa ay inclusiveness, o lahat dapat ay nabibigyan ng karampatang serbisyo at walang dapat na iiwan. At ang panghuli ay ang continuum of care. So kaya nga may first 1,000 days, magmula sa preconception hanggang first 2 years of life ng isang bata, ay dapat tuloy-tuloy ang pagbibigay ng serbisyo. Kung ano man ang kailangan serbisyo at anumang level o antas ng care service. So, sinasabi natin na ang First 1,000 Days Law ay ang aim niya talaga is to actually putulin ang intergenerational cycle of malnutrition. So, dapat magbigay tayo ng karapatang interventions para matigil na ang pagkakaroon ng intergenerational cycle of malnutrition, lalo-lalo na yung stunting o yung pagkabansot, dahil alam naman natin na ito ay may lifelong consequence sa ating mga bata. So ang mga bata na siyang magbubuo ng ating kinabukasan, dapat alagaan natin ngayong panahon. At ang Universal Healthcare Law naman, ang kanyang goal ay magbigay ng karampatan, appropriate na serbisyo sa lahat ng Pilipino. Anumang antas na kanilang kabuhayan at kung nasaan man sila, ay dapat mabibigyan ng karampatang serbisyo. So, kung titingnan natin, ang Universal Healthcare Law ay siyang parang umbrella law na nakapaloob-loob yung first 1,000 days, So, sinasabi natin, for purposes of this discussion, alam ko naman na kailangan multi-sectoral ang pag-atake sa nutrisyon dahil ang mga dahilan ay hindi lang galing sa health sector, At ang kasagutan ay hindi lang manggagaling sa health sector. But for purposes of this discussion, I will just focus on the health as one of the biggest sector contributing to the first 1,000 days law. So, ang sinasabi natin, halos karamitan sa nutrition, sinasabi sa MOB, mayroong nutrition specific at nutrition sensitive interventions. Ano? So kalamitan sa nutrition specific interventions o yung may direktong epekto sa ating nutrition ay nagmumula sa health sector o pinangungunahan ng health sector. No? Hindi man eksklusibo sa health sector, pinangungunahan ito ng health sector. So, dito, sa pagpasok ng universal healthcare, nutrition will not be regarded as an independent program. So, kailangan, sabi ko nga, ang prinsipyo is integration. So, ngayon, mapapaloob siya sa package of nutrition services addressing the life stage, no? So, across the life stage na rin siya. At yun din naman ang prinsipyo ng first 1,000 days, no? May life stage services din na ibinibigay. So, mula sa preconception, so ito yung mga adolescents or women of reproductive age, mula sa pagbubuntis, sa pagkapanganak, hanggang sa first 2 years of life of the child, ay nakapaloob yan sa ating package of primary care services. So, sa mga darating na panahon, parang hindi na natin isa-isang i-implement yung mga programa na ito may nutrition program, the infant and young child, kundi ito ay isang buong package of services para sa target population. Ano? Kung buntis man siya, kung bagong panganak man siya, kung bata man siyang bagong panganak, or within the 2 years of life. So, yun yung mangyayari sa universal healthcare, no? So, para naman magabayan ng mga health workers natin at ng mga local government units para sa pag-i-implement nitong first 1,000 days within the purview or within the context of the universal healthcare law. Ang Department of Health ay nagsasagawa ngayon ng pagbuo ng isang manual of operations para gabayan ang ating mga health workers. How are they going to deliver the package of health services across the life stage? Ganun din, may mga training modules tayong ginagawa para maituro itong manual of operations ay susuportahan ng mga training modules that will be delivered. At kahit na may mandanas ruling na magsisimula sa 2022, hindi kaagad bibitawan ng Department of Health ang ating mga local government units, lalong-lalo na yung mga walang kakayahan na i-absorb kaagad ang full responsibility of delivering the primary care services. Kasama na po dyan yung first 1,000 days services. Ano? Hindi po natin bibitawan kaagad. And I think it's inherent function pa rin ng Department of Health yung pagbibigay ng technical assistance and capacity building as the lead agency for health in the country. So, meron po tayong dinidevelop na mga training modules at may mga specific trainings din po na na-discuss ito kanina ni Doc Wilda kung ano-anong klase mga training at kung sino-sino mga iti-train. So, meron po kami DOH Academy na pwede po ninyong ma-access din yung mga specific training modules para sa delivery ng services within the first 1,000 days. Okay, so ang mga serbisyo na to sa universal healthcare ay itatransition natin, ano? Unti-unti nating ililipat sa local government units hanggang tuluyan na nilang makaya na ma-implement ito nang walang kinakailangan suporta pa from the national government. So magmula ito sa procurement ng mga commodities, pag-hire ng mga appropriate cadre of health workers, at ganun din yung mga necessary pagtatayo ng mga health centers or necessary health facilities as service delivery points sa ating mga local government units. So, ang first 1,000 days law ay nagsasaad kung ano-ano mga interventions ang dapat nating i-deliver, no? At ganoon din naman, ang Universal Healthcare Law, siya naman ang nagbibigay ng mechanism for financing and the enabling environment for effective implementation of these services. So the Universal Healthcare Law ay calls for a province-wide and a city-wide health system and a service providers network that every Filipino, especially our target in the first 1,000 days, can access and receive a continuum of appropriate care. So kagaya ng masabi ng lahat, critical sa implementation ng parehong batas ay ang leadership at ang commitment ng ating local government executives, no? And our LGU workers. Sabi nga natin, with the leadership of our local chief executives, the health workers, including the workers of the other government agencies, the private and non-government organization, the civil society, lahat po ng nandun sa community, all of their efforts can be, they can work in synergy towards a common goal of achieving health for all Filipinos. Ganun din po, ang mga local government units natin ay napaka-critical yung kanilang pag-angkin ng responsibilidad and accountability to deliver the nutrition and related health services. So itong manual na ito ay nagsasaad sa atin o nagbibigay ng guide kung paano natin ipaplanuhin, i-implement at i-monitor ang implementation ng first 1,000 days law. But the leadership as well as the commitment of everyone is really key for the effective implementation of this law. So maraming salamat po at napaka-critical sa mga darating na araw ang pag-scale up nitong implementation natin ng first 1,000 days law. Kaya tara na, sulong na po natin ang first 1,000 days law. Maraming pong salamat at mabuhay tayo.
Maraming salamat po, Miss Luz. So, narinig natin doon na ang RA 11148 ang nagdidikta ng mga serbisyong kailangan talaga, ang mga kritikal na serbisyong kailangan talaga ng ating mga mag-ina, lalo na po ng mga ating buntis at ng mga kabataan. At ang UHC naman po ang magbibigay ng gabay para sa mga LGUs, katulong ang 11148, ang first 1,000 day strategy para makahanap ng paraan para sa financing ng mga serbisyong ito at maging mas accessible pa sa ating mga kababayan ang mga serbisyong ito. Okay, maraming salamat po, Ms. Luz. Ngayon, papunta naman po tayo kay Dr. Marivic Samson ng National Nutrition Council. So meron po tayong 5 minutes, ma'am, para po dito sa ating question. So ang pressing po na talagang gustong itanong sa National Nutrition Council, sa critical po kasi na lugar ang National Nutrition Council para magkaroon ng, para mag-foster o yung mag-facilitate po ng multi-sectoral interventions para sa delivery ng health, nutrition, social protection, and agricultural services, kasama ang mga nutrition-specific and nutrition services natin. Ngayon, with RA 11148 at ang current strides towards the reduction of malnutrition, what is next para po doon sa ating magiging bagong Philippine Plan of Action for Nutrition at ang mga NNC efforts towards mobilization ng mga LGUs? Dr. Samson?
Maraming salamat, Aya. Magandang umaga sa ating lahat. Magandang umaga kay Kabsec, kay Miss Luz, at sa ating mga kagalang-galang at pinagpipitagang panauhin sa ating launching event ngayon. Ganun din sa kawanino ng gobyerno at sa buong masang Pilipino. Ang National Nutrition Council bilang pinakamataas na konseho ng gobyerno para sa programang pangnutrisyon ay ginagabayan ng pambansang plano natin sa mga programa at gawaing pangnutrisyon na tinatawag na Philippine Plan of Action for Nutrition or popular ito sa tawag na PPAN. Ito ang blueprint o ito yung dokumento na nagbibigay ng direksyon sa kung ano, paano, ang dapat gagawin at sino ang may tungkulin at responsibilidad sa mga gawain. Kung saan mang sektor o ahensya tayo nabibilang, mapagobyerno, pribado, mapanasyonal or lokal. No, ang PIPAN 12 programs at 45 projects na ini-implement no or isinasagawa ng ating mga kasanggang partner ng mga ahensya at iba pang mga pribadong ahensya no at sa pakikipagtulungan ng ating mga lokal na pamahalaan. Sa 12 programang ito ay 8 ang nutrition specific, isa ang nutrition sensitive at ang 3 naman ay mga enabling support programs. Bilang pagtatapos ng cycle ng PIPAN 2017 at 2022, makakaasa tayo na sa panibagong PIPAN no sa susunod na 2023 to 2028 ay mas pag-iigtingin pa natin ang mga programa upang malabanan natin ang hamon ng pandemya. Sa kalagayan pang nutrisyon, kasama dyan ang pagpapaunlad sa ating mga food security concerns, no? Hindi lang doon and nutrition aspects, no? Lalo na doon sa mga caring aspects. So ipagpapatuloy pa rin natin yung mga ibang programa na nakakuha tayo ng gains, no? Ng improvement dito sa pagtutuon sa first 1,000 days. So ngayon, sa kasalukuyan, nagsipaghanda na tayo no para sa successor PIPAN. And we can tell you right now is that we are committed to integrating more nutrition programs geared toward nutrition services during the first 1,000 days. Kasama sa plano ang ating patuloy na pagbibigay ng giya sa ating mga local government units, giya and assistance sa pagbubuo ng kanilang plano na tinatawag na Local Nutrition Action Plan. Ganun pa man, so sa pagbuo ng programang ito, nilalagay ang akmang projects and activities na naaayon sa local na nutrition problems. So dito, kailangan din mabigyan din sila ng giya paano ba yung tamang nutrition assessment para meron silang mabuong napapanahon na nutrition situation. So sa nutrition assessment, ang NNC ay nandito pa rin no para mabigyan sila ng kaukulang kaalaman at kasanayan, lalong-lalo na yung ating mga BNS. So para malukit, ma-identify sino ba yung apektado sa ating first 1,000 days, yung mga buntis na nanay, yung mga anak nila, no, yung mga bata, para meron tayong master list. Ba to, nasaan ba to? Nasa malapit ba to sa mga ilog or kung saan pa man, meron tayong malulocate. At ito ay pwede nating gamitin para sa referral at the same time, sila ang ating target sa mga services, sa prioritization ng ating programs. So, eto na. Ganun pa man, ang NNC ay patuloy na magbibigay din ng assistance sa mga priority areas para mabigyan sila ng mga tamang equipment. Halimbawa, syempre, yung mga timbangan, no? Height boards, and ganun din, yung pagtutulong ng BNS, pagtutulungan ng BNS at BHW kung paano sila no, magko-converge ng efforts sa nutrition assessment. And of course, kasama dito, since ang NNC merong gagawin no, sa pag-iigting ng kasanayan sa mga BNS, meron kaming pagpupulong ngayon sa test na para sa kasanayan nila. And kasama doon yung ating concern sa first 1,000 days. So sa dahilang ito, malaking tulong ang ating manual of procedures na gagamitin nila para yung kilos nila ay hindi watak-watak at kumbaga naaayon sa ating manual of procedures. So muli nais kong ulitin uli na ang paggagawa ng plano ng pangnutrisyon sa lokal na pamahalaan ay hindi lamang natatapos no doon sa dokumento, kundi ang NNC ay nandyan no para i-assist sila ma-integrate yung plano sa mga investment plan upang ang konseho sa lokal na pamahalaan magkaroon ng approval na talagang may budget. Kasi hindi naman to talaga mai-implement kung walang budget at kumbaga dapat strategic no, tuloy-tuloy yung support ng local government units sa first 1,000 days. meron silang focus, prioritization na nakalagay doon sa LNAP. So, yan lamang ang aming commitment. Pero ito, kung iisa-isahin natin in terms of activities, pag ibubuka natin yung PIPA, no, sa kabuuan, marami ang mga activities na ating pwedeng magawa. So, with that, congratulations sa DOH at sa ating mga kasamahan, no, sa kasamahan din natin sa NNC at ibang partners. So, hindi ko pa pala nabanggit, no, ngayon sa kasalukuyan kasi meron pala tayong dietary supplementation program na tinatawag na tutukainan, no. So ito ay napapaloob sa ating PIPAN sa pagpapatuloy, no, ng ating strategiya sa first 1,000 days. So given na meron na tayong modelo, no, sa ating ginagawa at this point, ito ay ating ihahain sa ating mga local government units na mapagpatuloy at magkaroon ng mas malawakang coverage, no, na walang maiiwan. So, ito yung isa nating banner program sa pagpapatuloy ng PIPAN. So, muli, maraming salamat, Aya, and to the DOH and other partners in this endeavor for the first 1,000 days.
Maraming salamat po, Dr. Samson. Again, hindi lang po yung congratulations ay para sa DOH, para sa ating lahat po ito dahil sabay-sabay tayong nag-develop ng MOP. At kaunting recap lang, ang sa NNC naman, itutuloy pa rin yung assistance para mapalawig ang kaalaman at kasanayan sa pagpapabuti ng local nutrition action plans para lalong mas matulungan ng ating mga local government units sa kanilang investments pagdating sa ating response sa hunger, malnutrition, lalo na po sa stunting. At gaya nga po na sinabi ninyo na ang next PIPAN, ang 2023 to 2028, mas mainam ang magiging mga programang tututok sa pandemya at gutom. Kasama na rin dito ang perspektibo ng kalusugan, nutrisyon, alaga, yung caring aspects natin, at ang integration ng mga programa. Maraming salamat po for the insights of the National Nutrition Council. Thank you po, Doc Dex. And now, we are going naman sa Office of the Cabinet Secretariat. As Secretary Nograles, we are so glad again to have you here. Sir, so this is something that's really exciting for us to ask because this is the first time since for the last couple of years, nasaksihan po namin yung leadership ng Office of the Cabinet Secretariat, lalo na po under sa inyong leadership na proactive po talaga yung pagtulak ninyo sa prioritization ng reduction of hunger and malnutrition, lalo na po nung nagkaroon tayo ng Executive Order number 101 noong January 2020 na nag-install po ng Interagency Task Force on Zero Hunger. Ito pong sa amin po dito, lalo na sa DOH, sa ating mga circles, sa ating LGUs, nakikita namin yung leadership ng OCS, ng Cabinet Secretariat, na this is stressing the importance of accountability of agencies and LGUs in nutrition of mothers and children, especially na na-test ito ngayong pandemya. We have seen the progressive national food policy developed and actively implemented. So para po dito, gusto po namin marinig mula po sa inyo, how does OCS as an institution under your leadership, sir, envision its role in driving down hunger and malnutrition for the next 5 years? And second question, sir, sisingit na lang po kami. What is the cabinet? What is your vision for a whole of government approach towards the achievement of optimum health and nutrition of women and children?
Maraming salamat, no. Una sa lahat, siguro ang importante sigurong na ma-emphasize natin ay sana ma-institutionalize po itong Interagency Task Force on Zero Hunger. Alam naman po natin na ang termino ni Pangulong Duterte ay hanggang June 30 of 2022 lamang. So sayang po pag hindi pinagpatuloy itong nasimulan na po ng Interagency Task Force. Ang trabaho po kasi ng Cabinet Secretary, isa sa mga trabaho ng Cabinet Secretary ay interagency coordination, no? Dahil nasa ilalim nga siya ng Office of the President at dahil sa basbas ng Pangulo ay ginagawa or sinisikap ng isang cabinet secretary na magkaroon ng coordination ng efforts ng iba't ibang kagawaran at ng iba't ibang mga kalihim na nasa kanya-kanyang kagawaran. No? Sa pagdating ng problema kasi ng kagutuman at malnutrition ay hindi po pwedeng nakaatang lamang sa isang departamento o isang kagawaran. Whole of government po ang kailangan dyan. Tulad na lamang ng laban natin against COVID, ganun din po yung laban against hunger and malnutrition. Hindi pwede na si department ganito lamang or si department ganyan lamang. Kasi nakita natin sa unang assignment na binigay ni Pangulong Duterte sa Task Force Zero Hunger ay magbuo ng isang roadmap, blueprint or strategy against hunger, against malnutrition, towards zero hunger naman po in 2030. Alinsunod sa commitment natin sa United Nations, Sustainable Development Goal number 2 na zero hunger by 2030. So pagbuo namin ng ating national food policy, nakita po talaga natin na dahil napaka-complicated, napaka-multidimensional ng problema ng kagutuman at malnutrition, ay hindi yan nakakonsentrate lamang sa isang departamento o isang kagawaran. Kailangan po yung problema na yan, hati-hatiin natin. Kaya ginawa mo namin, hinati namin to 6 key result areas. And per key result area, may mga assignments tayong binigay sa kanya-kanyang kagawaran, departamento, ahensya ng gobyerno, no? Para focus pero kailangan synchronized. So importante po na sana sa susunod na administrasyon at sa administrasyon pagkatapos po niyan ay mapanatili po na merong isang opisina na siya yung kumbaga timon at siya po yung mag-ano ng coordination, no? Siya ang timon, siya yung magfa-facilitate ng coordination, collaboration, leading towards the goal na zero hunger at zero malnutrition. Para sa akin, tamang-tama yung Office of the Cabinet Secretariat dahil nasa ilalim siya ng OP, ng Office of the President, at siya nga po yung in charge sa interagency coordination. So kailangan po yung tinatawag natin na whole of government approach. So in terms of pushing or nudging, implementing agencies, in terms of convergence efforts, in terms of championing yung kinakailangan na budget at support na kinakailangan ng implementing agencies dahil nasa ilalim siya ng Office of the President, mas madaling i-coordinate ang lahat ng yan. So yan ang nakikita kong na-envision ko for the next 5 years or 6 years or 10 years or even more na ma-retain po ng OCS or the Cabinet Secretariat yung function na yan at sana ay magpatuloy yung Task Force Zero Hunger. Dahil kung titingnan natin, sabi na nga, nabanggit na ng NNC, meron silang tutok kainan complementary feeding program. Meron din po tayong tinatrabaho na Philippine Multi-Sectoral Nutrition Project kung saan very key ang support roles ng Department of Health at DSWD pero may key support role din po ang Office of the Cabinet Secretariat. At marami pa pong iba na kailangan nating trabahuin, especially dito sa first 1,000 days. Ngayon, pagdating naman sa whole of government approach, ang challenge ko po sana nga is not just whole of government, no? Nabanggit ko na itong whole of government approach, pero kailangan ma-expand po natin to a whole of nation at whole of society approach. Kung papansinin mo yung ating national food policy, babagatin ko lang, no? There are 6 key result areas. Una-una, yung policy environment na kailangan natin. The policy environment, the laws, rules, regulations, even ordinances na kinakailangan to combat hunger and malnutrition. Number 2 po, yung production of food. Number 3 po, yung securing nutrition or ending all forms of malnutrition. Number 4 po, yung accessibility ng pagkain. Number 5 po, yung resiliency and sustainability ng ating food systems. Ang pang-anim po, which is what I want to focus on dito sa aking sagot, is that kailangan po ng people participation. So kaya nga po hindi po pwede na whole of government lamang. Kailangan i-expand natin to a whole of society and whole of nation approach. Kasi para labanan ng problema ng kagutuman at malnutrition, kailangan po natin ng support at tulong ng bawat isang Pilipino. So with people participation, with a whole of society approach, lahat po ay may ambag dito sa laban na to. Ordinaryong mamamayan, academe, civil society, non-government organizations, private corporations, hanggang local government units. So lahat po yan, national government, local government units, lahat po tayo ay we all have our role to play. So ang success ng first 1,000 days of life na batas, ang success ng implementation ng batas na yan at nitong paggamit nitong ating manual of procedures, nakaatang po yan at responsibilidad ng bawat isa sa atin. Importanteng malaman ng taong bayan ang importance ng first 1,000 days, maintindihan nila at malaman din po ng bawat isa kung ano yung gagampanan nilang role para ma-fulfill po ang gusto nating objectives nitong first 1,000 days of life. So yan po, yan nakasalalay po sa ating lahat ang tagumpay nitong first 1,000 days of life.
Thank you, Secretary Nograles. Actually, that's very interesting that you point out yung kahalagahan ng institutionalization ng IATF on zero hunger. Nabanggit po kanina sa presentation ng Save the Children, and lagi po ito nababanggit sa mga presentation ng mga experiences pagdating sa implementation ng first 1,000 days sa LGU, na mahalaga talagang merong local champion, and hindi madaling makakita ng local champion. Pero actually, for the since pumasok po kayo sa office, and with your whole team, naging obvious na meron tayong national champion, and this is something that we want to sustain for the next 10 years, 20 years, para merong continued leadership pagdating sa coordination and collaboration, which is super important pagdating sa response to not just public health, but development itself all throughout. Again, I also want to emphasize yung challenge na sinasabi po ninyo na kailangan talaga hindi lang whole of government approach, kailangan lahat tayo ay aware mula sa gobyerno hanggang sa ating mga mamamayan kung ano po yung dapat na mga roles na ginagampanan natin, dahil mayroon sa gobyerno po, I think madali po talaga sa ating gumawa ng paraan na maging available ang services, pero isang challenge din po yung iparating sa ating mga kababayan na kailangan gamitin yung mga serbisyong ito para matulungan natin ang isa't isa for our goals. Maraming salamat po, Cabsec Nograles. I hope you stay with us para po sa mga questions natin for the rest of the panel discussion. Maraming salamat po, sir. Okay, let me see if nandito na po si Ms. Cheryl for DSWD.
Nandito na po.
Hi ma'am. Magandang umaga po. For our teammates, baka maaari naman po magpa-spotlight kay Ma'am Cheryl. Hi Ma'am Cheryl. So, it's very nice to see you po representing Director Naviamos. Hi ma'am. It's this is the first time I think that we are seeing each other. But para direksyon na po tayo doon sa ating tanong, kung maaari. So, ang DSWD naman po has given us so many important social protection programs, such as yung 4Ps, yung Pantawid Pamilyang Pilipino program natin, ang Kalahi Seeds Project, aimed at uplifting our countrymen to break the cycle of poverty. Do you think na mayroon pa po bang room for more in-depth multi-sector interventions para makorek ang health behavior at ma-uplift ang food security sa loob ng ating mga social protection programs, at para mapataas din yung uptake ng healthcare and nutrition services para sa ating mga kababaihan at mga kabataan, pati na po sa ating mga adolescents? If yes, tuloy-tuloy ko na po yung mga tanong. How does DSWD envision itself bilang isang kagawaran na nakikipagtrabaho, nakiki-engage sa iba pa pong mga ahensya ng gobyerno at mga LGUs to make this possible?
Thank you, Ms. Aya. Good morning po sa lahat. Good morning, Cabsec. So, una, I would like to congratulate the DOH sa pag-put together nitong Manual of Procedure na to, which is a very useful resource for frontliners natin in ensuring na integrated nga yung approach in addressing yung nutrition-related concerns natin, no? And to answer the question, actually yung ating current na program on nutrition na pinapatupad ng DSWD, which is the Supplementary Feeding Program, isa ito sa mga social protection programs na tumutugon sa malnutrition ng ating mga kabataan. At alam natin na ito ay ini-implement sa mga daycare centers o yung tinatawag nating child development centers nationwide at sa mga batang kalahok din sa supervised neighborhood play or yung SNP natin, na mas mababa ang mga nasa under 2 ang kanilang siniserve naman. Sa pamamagitan ng pagbibigay ng hot meals at sa kasalukuyang batas natin, yung sa RA 11037, dinagdag pa yung milk feeding para mas ma-address yung stunting among children. No? At matuturing na multi-sectoral din ang approach nito dahil sa pagtutulungan ng iba't ibang ahensya kagaya ng DA through the NDA, yung ating National Dairy Authority, and then yung PCC natin kasi sila yung supplier natin ng fresh milk. And also yung DOH, ang NNC, ang ating LGUs, lalo na at ang DOST-FNRI. So marami pa siya, marami pang mga katuwang ang DSWD dito sa pag-implement ng feeding program. At bukod sa pagbibigay ng supplementary food sa mga bata sa child development centers at sa mga SNPs natin, ang mga magulang din ay umaattend ng tinatawag nating parenting effectiveness sessions or yung PES, kung saan may iba't ibang modules at kasama na dito yung tungkol sa health and nutrition. So kabilang din sa mga topic sa module na ito ay ang care for common childhood, dental care, prevention and early detection of childhood disabilities, basic nutrition, yan, mga kasama po yan. And then, nutrition during pregnancy, yung lactation, infancy and infancy, pati na rin yung growth monitoring, tinuturuan din sila doon. At sa kasalukuyang PES module, ito po ay nire-review with the help of UNICEF para mas ma-address pa natin yung iba pang nutrition-related concerns like obesity. So isa po yun sa alam natin na tumataas din ang mga bilang ng kabataan natin na nasa ganitong spectrum, nasa pinaka dati malnutrition lang, ngayon may obesity na concern. And in 2022, ipapatupad na yung Mandanas ruling at isa po ang programang ito sa mga madidevolve sa mga LGUs natin. So ibig sabihin, yung pondo na kasalukuyang nasa DSWD ay mabibigay na sa mga LGUs para sila na ang direktang magpatupad nito. So isa sa hangarin ng DSWD na sana masunod pa rin ng mga LGUs yung tamang implementasyon ng programa katulad ng kung papaano siya dinisenyo o di kaya masigitan pa nila to cover more children, and also kung pwede nilang ma-increase yung budget ng per bata na sa ngayon nakapeg at 15 pesos, kung pwede nilang higitan to 27 or 30 pesos, the better, no? To cover more children and to give them more nutritious foods na kailangan nila. And also, ang DSWD naman po, once na magpatupad yung mapatupad ang Mandanas ruling, ay lagi lang nakahanda at nakaantabay sa mga LGUs para sa tulong teknikal sakaling kailanganin nila ito para sa pagpapatupad ng programa. And also, banggitin ko na lang, in support to the F1K, meron din pinapatupad ang DSWD, which is yung bangon program namin, which includes feeding for pregnant mothers. However, this is only concentrated sa aming barn area. So, yun lang po. So, with that, maraming salamat and I will stay for kung may question pa po. Thank you.
Maraming salamat po, Ms. Cheryl. So it's also nice to hear yung specific programs natin na handog ng DSWD para makakontribute sa ating first 1,000 days goals. Nandito yung ating care para sa yung tuloy-tuloy, yung life stage approach care para sa ating mga kabataan kasama yung kanilang mga pamilya. So sa BAR, meron tayong example ng ating bangon program. And I think I'm a bit familiar po dito sa programang ito and focuses on the health and welfare of mothers and their families. Next is, of course, even with the devolution of services, tuloy-tuloy pa rin ang technical assistance ng DSWD sa ating mga LGUs pagdating sa implementation ng kanilang mga programa. And mas makakatulong rin po sa implementation ng mga programa ay yung increase ng budget para sa bawat batang sineserve natin para ma-cover ang mas marami sa kanila at mas maging nutritious pa ang kanilang mga kinoconsume. Okay, so mag-entertain po tayo ng mga tatlo or apat na questions mula po sa ating mga audience. Meron sa ating participants. Ngayon, ang participants po natin ay nanggagaling sa mga, karamihan sa kanila ay nanggagaling sa mga LGUs. Nakikita natin sa participants list. Meron po kaming mga nakuha mga question ngayon. Okay. Let's see. And I think this is a question that could be for the National Nutrition Council. Ito po ay napakaraming beses naming nakitang paulit-ulit na katanungan sa ating Q&A, sa ating chat box, pati po sa ating YouTube. Ito po, pero kukunin natin yung version na mula sa local government unit ng Masbate as Dr. Arrollado. We all know that implementation of the first 1,000 days in other nutrition PPAs are very heavy and difficult. Compensation of barangay nutrition scholars is very important to ensure support to human resources. Since Cabinet Secretary Nograles is here, and this is only part of the question, can we recommend the review and amendment of the compensation for barangay nutrition scholars? And I think also other questions also look at barangay health workers, particularly the standardization of their salary or honoraria and make them permanent health workers for our nation. Thank you.
Sino ang sasagot? Ako or?
Sir, I think maganda po muna na si Dr. Samson ang sumagot, and then it would be great po if you could also supplement her answer. Thank you. Hi, Doc Dex.
Hi, Miss Aya. Maraming salamat po sa nagbigay ng katanungan yan, and truly, we recognize talaga yung efforts ng BNS no, sa pagpapatupad at pagtataguyod ng ating mga programa pang nutrisyon, lalo na sa mga kasuluk-sulukan ng mga barangay. And for this, since kasi under PD 1569 talagang mayroon lang akmang pagkilos ang pwedeng magawa ng NNC. Ngunit hindi kami tumitigil sa paghahanap ng ibang pathways para matulungan ang ating BNS. So isa na nga yan doon sa nabanggit ko kanina, meron kaming training na ibibigay, parang more on ladderized training for this BNS para ma-professionalize din sila later on. And sa pagtutulungan yan sa office ni Kabsec din, maitataguyod natin ito. And hindi lamang yon, marami pang mga assistants na i-refer natin ang mga BNS, and doon sa ating pagbibigay ng standardized na mga allowances, hindi naman natin masasabi na salary talaga. So, mga allowances, ibang incentive. So, ang NNC as policy making ay nakikipagtulungan din kami sa mga potential na champion for the BNS upang makapagsulong ng batas at polisiya para talagang maiangat na yung aming kasalukuyang naibibigay sa kanila, kasi medyo minimal in terms of yung financial, pero meron naman po kaming mga medical assistance and survivorship assistance na which for now ang dami po talagang nagki-claim sa panahong ito. Yon ipagpapatuloy namin, ngunit sa paghahanap namin ng champion, magtutulungan kami estimate kami ng akmang kung magkano ba talaga no ang maitatama naming insentibo para sa kanila. And I'm sure nasa likod namin talaga si Kabsec no for this, and isa na siya talaga sa tinatanaw nating champion. Nako, ayan si Kabsec for this BNS, for the continuing support. Hindi ko man masabi ngayon kung magkano, ano ba talaga yung palisiyan na to, pero sa pagbabalangkas nito, meron na kaming ginagawa no sa level namin sa NNC, kasi iba-iba po ngayon ang binibigay ng ating mga local government units, depende sa kanilang kakayahan. Kung i-standardize natin yan, syempre yung ibang nasa kasalukuyang medyo mataas-taas na naantas, baka naman magreklamo. So medyo kailangan din ng pag-aaral para ano ba yung cap for this. So, yun lamang. Andoon na kami sa puntong yun, at wag po kayong mag-alala at ginagawa po namin ito. Thank you very much.
Thank you, Dr. Samson and Secretary Nograles.
Tama po yung sinabi ni Doc Samson, kasi gaya ng nakwento ko na kanina sa task force or interagency task force on zero hunger, yung key result area number 1 is policy, no? Policy formulation, policy environment. At ang ginawa po namin ay isa-isa. Tinatanong namin yung mga members ng task force kung ano ba yung mga gusto nilang isulong na mga polisiya or di kaya mga legislative measures na kailangan nating isulong din. No? So isa sa mga sinusulungan ng NNC ay yung better benefits para sa BNS natin. No? Pagkilala ng importance ng BNS, pagbigay natin ng better benefits ng BNS, at maaring mangangailangan ito ng push sa Kongreso. Ibig sabihin, kailangan ma-legislate. So isa yan sa mga wish list ng NNC na sinusulong din ng IATF na magkaroon ng bagong legislation or pagsasabatas ng added benefits for BNS. Hindi lang para mapagkilala ng importance ng role ng BNS sa bawat barangay, kundi pagbigay din po ng sapat na compensation at benefits, at pag-institutionalize na rin po natin ng BNS sa bawat barangay. At syempre, isa pa sa mga sinusulong namin, ang strengthening din ng NNC. Kasi kailangan rin po natin bigyan ng kinaukulan at nararapat na suporta ang National Nutrition Council, lalo-lalo na nakikita natin ngayon sa panahon ng pandemya kung gaano kaimportante ang nutrisyon sa taong bayan, sa bawat Pilipino at Pilipina. At lalo at higit sa mga buntis na nanay at sa mga batang musmos, yung sa first 1,000 days. So we really need to strengthen the institution ng NNC, at yes, yung pag-institutionalize din natin at pagbibigay natin ng tamang benepisyo sa ating mga BNS.
Maraming salamat po, Secretary Nograles and Dr. Samson. Sa susunod po nating tanong, ito po ay bibihira nating makuhang katanungan mula sa akademya. At I think magandang tanong ito para ulit sa inyo, Secretary Nograles. Pero mauna po muna tayo kay Ms. Luz Tagonicar. Also, Ma'am Cheryl, if you may, meron po tayong katanungan mula po sa University of the Philippines, Manila. Okay. Mula po sa University of the Philippines ng Manila, kung ano po ang maaring maging role ng akademya pagdating sa integration po ng mga programs, lalo na po sa first 1,000 days. Ms. Luz?
Sabi nga natin, kailangan natin ng lahat ng suporta, no, when it comes to the implementation of the first 1,000 days. And sabi nga ni Kabsec, lahat may role, no, magmula sa mga government institutions, especially also the academe, as well as yung mga beneficiaries. Ang academe ay kapartner natin yan sa mga paggawa ng polisiya, pilot test or pag-models ng mga interventions, the research kasama din natin, ano. And also, they can also be our partners in developing the capacities of our local government workers, no? So, aring mabigyan din sila ng role bilang lalo-lalo na yung may mga network, ano, yung may mga consortium na pwede rin na magkaskade o magbahagi ng kanilang training capacity or technology sa mga counterparts nila doon sa mga regions, no? So kailangan din natin kasi yung mga local training providers or capacity builders, particularly doon sa quality health services as well as research, no? And of course, yung piloting and modeling of intervention. So, diyan sila makakatulong at maging sa policy advocacy, no? Dahil sa mga research findings nila, they can produce policy briefs and policy recommendations to different sectors of the government to help implement the first 1,000 days. So, yun yung nakikita kong role ng academia. Thank you.
Maraming salamat po, Ms. Luz. Anything to add to that? Cabinet Secretary, sorry,
Yes.
I need to also ask you about this because it will
No,
be
no.
interesting para makita po yung perspective ninyo pagdating sa participation ng academic sector sa ating advocacy.
Actually, interestingly at timely, no? Kasi mga 2 weeks ago ay may nakausap po ako mula sa academe, although private ito, no? Private university, kilalang university, na meron silang ginawang initiative na ang tawag ay Zero Hunger Lab. So parang Zero Hunger Laboratory. So nagpa-briefing ako sa kanila kung anong ibig sabihin ng initiative nila na Zero Hunger Lab. So yung kanilang nakwento at na-explain po sa akin ay ang gusto nilang mangyari ay kung ang ma-involve natin ang lahat ng mga academe na mag-create din ng something akin or something similar to a Zero Hunger Laboratory na kung saan makikipag-tie up po yung university sa local government units. Preferably yung local government units kung saan siya nabibilang or kung saan malapit yung jurisdiction. At sila yung mag-act as extension services, research, development, and extension services. So in terms of formulating policy, in terms of formulating interventions, in terms of testing interventions, looking for the problem, finding solutions, and then in coordination with the local government unit, whether municipality or provincial or kahit barangay level, na magkaroon sila ng tie-up for extension services, research and development. So malaki yung tulad ng malaking role ng academe tulad ng first 1,000 days, no. Kunyari sa first 1,000 days mag-develop sila ng initiative with the local government unit na ganoon din po to try models out, mag-modeling sila, mag-research and development sila, and then to try certain models kung gaano ka-effective para matulungan din, no, ang LGUs in terms of implementing programs targeting the first 1,000 days of life. Taking into consideration na Mandanas-Garcia ruling na tayo sa 2022. Ang ibig lang po natin sabihin, ano bang gagawin ng mga LGU sa dagdag pondo na makukuha nila? 'Di ba? Ang gusto natin i-nudge o direction na gusto nating i-lead ang mga LGUs ay tutukan nila yung first 1,000 days of life. Tutukan nila yung mga nutrition specific and nutrition sensitive programs nila, no? Huwag nilang kalimutan 'yan. Kasi baka ang tendency is infrastructure, 'di ba? And all of these things mabuti 'yan para sa development. But kailangan sustainable din ang development, and there is no other more sustainable way to develop your locality than to invest in the first 1,000 days, because yan ang future workforce mo. Yan ang future ng iyong bayan. So kung lahat ng mga kabataan ng iyong bayan ay fully developed physically and cognitive, no, yung kumbaga yung in terms of pagkatalino, pagka-bright, na-reach yung full brain potential, then you are securing the future of your locality. So sana makita ng mga LGUs natin na ganun. But again, dahil sa dami ng ginagawa ng mga LGUs, malaking tulong yung academe, di ba? To provide that sort of extension support, research development, piloting, para at least malaman din ng LGU na, di ba, kasangga niya ang kanyang ang university within his jurisdiction. At nakakatulong 'yon in terms of information and interventions.
Second, I think it's really, also very curious that you pointed out yung kahalagahan ng operations. Basically, it's operations research, contribution ng ating mga academe pagdating sa ating implementation. And you also pointed out yung kahalagahan ng investment, tamang investment ng mga LGUs pagdating pag naging in effect na yung Mandanas ruling. And these operations researches, I believe, are key para makakita ng talagang efficient scientific interventions para ma-resolve yung ating problem pagdating sa malnutrition, sa hunger, and even sa poverty and development problems natin. And it's also very good na beyond assistance pagdating sa capacity building, we are looking at academic institutions as the extension of our interventions para sa ating countrymen. So thank you very much for that. And thank you also, Ma'am Luz, for emphasizing that they are also very important pagdating sa supplementation ng ating workforce para mapalaganap yung ating mga capacity building at modeling activities to help our LGUs with their malnutrition response. Okay, so thank you for that. We have here our last question. So I think I would like to start with Ms. Cheryl of the SWD Program Management Bureau with a question from the Malolos office of Honorable Enrico Capule. Isa po siya sa mga LGUs natin. We are in a pandemic situation. And we would like, I think it will be good to start with the SWB for this question. How can LGUs deliver first 1,000 days services? Maybe we should just look at just nutrition services muna, because the whole spectrum is very, very broad. We can start looking at from the SWB, your feeding services and your care services. How can these be delivered to the public, especially through the health sector? Or maybe we could just look at delivering these services during the pandemic from the perspective of the SWB.
Okay, good morning. Ayan po. Thank you sa tanong. Actually, they can take reference po on the guidance notes that we have issued para lang po masundan din nila kung paano nag-adapt yung program dahil dito sa pandemic, na if before we do it by yung pag-provide talaga ng hot meals, and because the child development centers are now closed because of the pandemic, we now resort to door-to-door or house-to-house distribution of the food ration para mapagpatuloy pa rin yung programang pangnutrisyon sa mga bata na kalahok sa daycare centers natin. So isa po yun. And also, pagbibigay ng mga nutri-dense food, at saka kung sa ngayon, we do twice a day feeding para lang mas maboost pa yung kanilang immune system at makatulong pa sa kanilang nutrition. So, naglabas po ng mga guidance notes ang department on how we could adapt to the situation that we are now in. So, yun po. So, for the supplementary feeding program, that's what I can speak of for now. Thank you, ma'am.
Maraming salamat po, Ma'am Cheryl. And one thing that gusto rin pong mailabas ng ating mga participants is hopefully there will be more discussions on the emphasis of breastfeeding with the first 1,000 days strategy as a strategy to prevent stunting and wasting. And another question, maybe if Doc Wilda is still in the room, shouldn't there be more support for breastfeeding support groups at this time and moving forward? Ms. Luz and Dr. Samson, if you may, you can also answer the question.
Hello, Ms. Aya?
Yes.
Doon sa kasalukuyang ginagawa namin, doon sa aming regional offices, they have programs to support the breastfeeding groups, in terms of, giving them materials, and then they are part of some webinars, they were invited, and of course, kung magiging mapabuti na yung ating kalagayan, we can continue on with yung ating ginagawa before na talagang meron talagang face-to-face na activity din at sa darating na panahon magawa natin yon. Pero hindi naman po tayo natatapos, no? This is a continuing activity. Meron po diyang talagang invited sila sa mga webinars at nagpo-provide po kami ng mga resource persons as well as nagpapadali din po kami ng mga materials they can use. So, yun po.
Thank you, Dr. Samson. Anything to add po, Ma'am Luz? Very quickly.
Yes, I think to answer the question na importante ba talaga ang breastfeeding for the first 1,000 days, napaka-importante po niyan kasi yan yung unang pagkain na binibigay natin sa ating mga sanggol, no? And kung hindi na napasuso o napakain na maayos during the early part of the life of the child, nakakaroon na kaagad ng problema. So, kaya ang Department of Health ay talagang nagsusulong ng programa ng Infant and Young Child Feeding Program kung saan maraming mga polisiya na inilalabas ang Department of Health. Ganun din, tumutulong kami sa pag-implement ng Executive Order 51 or yung tinatawag natin na milk code. Oh, the milk code. Nakalimutan. Yung milk code na alam natin, ano? So, ganun din yung pag-advocate for the mother-baby friendly hospital initiative. At maraming advocacy at napaka-importante talaga sa local government units ang magkaroon ng support groups, no? O yung mga grupo ng mga nanay na nagsusuportahan para maging successful yung kanilang breastfeeding. Lalo na doon sa mga first time pa lang magpapasuso, pag naka-experience sila ng problema sa pagpapasuso at walang gumabay sa kanila o walang sumuporta at nagturo sa kanila ng tamang paraan paano nila ma-overcome yung mga breastfeeding problems nila, ay mapipilitan niya na tumigil o mag-switch sa ibang feeding modes para sa kanilang sanggol. Kaya napaka-importante yun. At dahil pandemya, meron naman tayo mga online support groups, no? So may mga support groups tayo na makikita natin na nakabase sa Facebook at meron din sa mga local communities ninyo that can provide support through online. So marami pong paraan at dahil sa pandemya, kailangan po nating mag-adapt at gumamit ng teknolohiya bukod doon sa face-to-face para marating natin ang ating mga targets. Marami po tayong dapat i-adjust dahil sa pandemya at maging sa lahat ng pamamaraan, pag-deliver ng services, pagsusukat ng mga bata, talagang kailangan po lahat ng adjustment. And it's going to be a challenge to all of us at saka, lalo na sa mga local government units. At patuloy tayong sabay-sabay na mag-aaral kung ano ba ang what will work in our communities and what will not. At kung paano natin i-adjust o i-adapt ang pag-deliver ng mga serbisyo base sa ating konteksto, kalagayan at sitwasyon. So iba-iba tayo, kaya't iba-iba rin ang dapat maging pamamaraan natin. So yun po, kailangan natin lahat na mag-aral at mag-aaral.
Maraming salamat po, Ms. Luz. And okay, so we have run out of time, but thank you so much for all of for your time sa ating mga panelists. For Cabsec Nograles, thank you so much for your generosity for giving us this opportunity to discuss the first 1,000 days with your office. Thank you so much also to one of our nutrition pillars. Paulit-ulit na lang po namin sinasabi palagi si Ms. Luz Tagunicar from the Disease Prevention and Control Bureau. And one of our greatest partners po, si Dr. Samson. Thank you so much for joining us in this panel. And to Ms. Cheryl Mainar of the Program Management Bureau of DSWD. Thank you so much, Ram. It's always nice to have to talk to someone new. Thank you so much, and we hope to also speak with you in the future. And with this, maraming salamat po sa inyong mga questions. We will try to address them after this session. And naibigay naman po sa inyo ang aming email address, familyhealthoffice@toh.gov.ph. And huwag niyo pong kalimutan na i-access regularly ang first 1,000 days manual of procedures. Ito po ay available through the QR code na maaari namin ipadala muli sa inyo o sa doh.gov.ph/1000 1000-MOPR 1,000 days MOPR. Muli, maraming salamat po sa inyong lahat, and may I call on Dr. Mara for our closing. Ingat po tayong lahat.
Ma'am Aya, muli maraming salamat po sa pagdalo sa ating launching of Manual of Procedures para sa pagpapatupad ng Republic Act 1148 ng Kalusugan at Nutrisyon ng Magnanay Act. Hindi makukumpleto ang event ngayon kung wala ang suporta ng UNICEF, NNC, Save the Children, DSWD at ang mga kasamahan natin sa DOH. Para sa pagsasara ng ating pagdalo, maririnig po natin ang mensahe mula kay Director Beverly Ho na tumatayong Director ng Disease Prevention and Control Bureau at ng Health Promotions Bureau. At susundan po ito mula naman sa NNC ay si ASEC Azucena M. Dayanhira, ang Executive Director 3 ng National Nutrition Council.
Thank you all for being with us virtually today and supporting our Sulong First 1,000 Days launch of the Manual of Procedures on the implementation of RA 11148, ang Kalusugan at Nutrisyon ng Magnanay Act. Indeed, the value of this Manual of Procedures will not go unnoticed as we all acknowledge our critical positions as implementers of the law. We all want a very clear strategy for every Filipino's child future as we are in the power of ensuring healthy lives, promoting their well-being, and achieving good nutrition for all at all ages. We want to be able to provide comprehensive, sustainable strategies and approaches so that we can address both health and nutrition problems of children, pregnant and lactating women, adolescent, because we know that there are multiple factors that will affect their health and nutrition. Most of the program components in RA 11148 are actually existing programs implemented at various levels but with various coverage and quality. And this is one we want to fix in a more integrated and holistic manner. And that's why the MOPR proposes a way to manage and organize all these competing programs that are being implemented in a very vertical nature currently. So our desired result is really to be able to provide the needed services with value for money. To be successful, our various programs, Manchan, Adolescent Health, Responsible Caregiving, IMCI, WASH, Child Protection and Security, along with ECCD and Food Security must be supported and integrated following a family-centered approach and a whole-of-government action while adhering to our nurturing care framework for helping children survive and thrive to transform health and human potential through research, planning, budget, implementation, and M&E. I would like to thank our fellow national government agencies, our LGU partners, development partners, CSOs, academic institutions, and all those who contributed in the development and birthing of this MOPR, reiterating the importance of commitment and collaboration of various stakeholders to help our province, municipalities, and barangays in achieving and implementing the first 1,000 days strategy, which focuses on, as we know, nutrition-specific and nutrition-sensitive interventions. Let us all work together in this unique window of opportunity to act and have a better health outcomes for all Filipino children and achieve the main purpose set out in RA 11148. Maraming salamat po at ito lang po ang simula ng ating better implementation for better health of our mothers and babies. Thank you very much.
Maayong buntag sa tanan, it is my pleasure to see everyone present in this launch representing different sectors of nutrition stakeholders, from government agencies, local government units, civil society organizations, development partners, and the academe in good health. Today marks an essential milestone in the landmark legislation for Republic Act number 11148, or otherwise known as the Kalusugan at Nutrisyon ng Magnanay Act, or the first 1,000 Days Law. While it has been almost 3 years since the law was signed in 2018, we continue to improve the programs. Maayong buntag sa tanan, it is my pleasure to see everyone present in this launch representing different sectors of nutrition stakeholders, from government agencies, local government units, civil society organizations, development partners, and the academe in good health. Today marks an essential milestone in the landmark legislation for Republic Act number 11148, or otherwise known as the Kalusugan at Nutrisyon ng Magnanay Act, or the first 1,000 Days Law. While it has been almost 3 years since the law was signed in 2018, we continue to improve the program's implementation. Focusing on the first 1,000 days of life is one of the strategic thrusts of the Philippine Plan of Action for Nutrition, or PPAN, 2017 to 2022. It was also part of the chosen theme for this year's Nutrition Month campaign, as we recognize the vital role of the first 1,000 days in our fight against all forms of malnutrition. As we move forward to address food and nutrition issues in the country, let this policy document, the first 1,000 days manual of operations, become our tool to reliably and efficiently carry out our task with consistent results across all governance levels, from the national down to the barangay. We envision this manual of operations will be used in its most genuine purpose to achieve our primary objective in providing sustainable, comprehensive, multi-sectoral strategies to address health and nutrition problems of newborns, infants, and young children, pregnant and lactating women, and adolescent females, as well as multifactorial issues that negatively affect them. Consider the man-ops, our Holy Bible, in the first 1,000 days service delivery. If we follow and put into practice every verse by heart, I am sure we will not go in vain, because we owe a quality F1K service to all our kababayans. Let us not fail our children. Let us fight for them as we fight the pandemic. Again, daghang salamat sa tanan at mabuhay po tayong lahat.
Director Beverly Ho and ASEC Azucena Matayang-Hirang, maraming salamat po sa inyong mga iniwang mensahe para sa ating makasamahan ngayong araw na ito. Dito na po nagtatapos ang ating pagdalo. You may access our evaluation po nasa chat box. Maganda at malusog na tanghali po sa inyong lahat. Salamat po.
Hello there, mga mommy. Let's go for healthy pregnancy. Tamang pagkain ng dapat para malusog kayo ni baby. Remember mga nanay, breastfeeding malaking bagay. Ito'y ipagpatuloy kahit na over 2 years old. Tamang nutrisyon, don't forget, yan ang tamang solusyon. I like it, laking one, oh, 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 yan ang tamang paraan. Tamang nutrisyon, don't forget, yan ang tamang solusyon. I like it, laking one, oh, 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 yan ang tamang paraan. Ang iyong little girl or boy, sustansya'y dapat puno. Susi sa tamang paglaki, go grow glow food na handa mo. First 1,000 days importante, healthy eating para kampante. Paghandaan nutrition ni baby, makinig sa sinasabi. Tamang nutrisyon, yan ang tamang solusyon. I like it, laking one, oh, 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 yan ang tamang paraan. Tamang nutrisyon, yan ang tamang solusyon. I like it, laking one, oh, 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 yan ang tamang paraan. Laking one, oh, 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 yan ang tamang paraan.
The Philippine Plan of Action for Nutrition, or PPAN 2017-2022, is an integral part of the Philippine Development Plan 2017 to 2022. It is consistent with the Duterte administration's 10-point economic agenda and the Philippine Health Agenda. We have had previous PPANs before, but much more needs to be done to improve the implementation of nutrition plans and programs. We are better placed now to achieve our goals because we are guided by data and benefit from local and global evidences on what works and what needs to be done. The PPAN consists of 12 programs. 8 are nutrition specific, 1 is nutrition sensitive, and 3 are enabling support programs.
First, the Infant and Young Child Feeding Program encompasses promotion of exclusive breastfeeding for the first 6 months and appropriate complementary feeding with continued breastfeeding up to 2 years and beyond. Second, the Integrated Management of Acute Malnutrition will provide nutrition and medical services to almost 800,000 moderately and severely acute malnourished children 0 to 59 months old. Ikatlo, ang National Dietary Supplementation Program ay naglalayong madagdagan ang kalidad ng pagkain ng mga buntis, nagpapasusong ina, 6 hanggang 23 buwang gulang na mga bata mula edad 3 hanggang 5 taong gulang at 6 hanggang 12 taong gulang.
The National Nutrition Promotion Program for Behavior Change shifts from the usual increasing awareness of nutrition messages towards a strategy that will enable the adoption of positive nutrition behaviors.
Ikalima, patuloy ang paglaban sa micronutrient deficiency sa pamamagitan ng micronutrient supplementation. Libreng ipamamahagi ang mga supplements na vitamin A capsules, iron folic acid tablets at zinc para sa mga sanggol, mga batang mag-aaral, women of reproductive age, mga buntis, at mga nagpapasusong ina. Sixth, the mandatory food fortification program complements the micronutrient supplementation program. Itutuloy ang pagdadagdag sustansya sa mga pangunahing pagkain ayon sa Food Fortification Law at Salt Iodization Law. 7th, the Nutrition in Emergencies program assures nutrition protection and food availability during emergencies and disasters. Lastly, the Overweight and Obesity Management and Prevention Program focuses on promoting a healthy food environment, promotion of healthy lifestyle, and weight management interventions to address this emerging trend.
Nutrition-sensitive programs are development projects that are tweaked or modified to produce nutritional outcomes.
Enabling support programs will make sure that government agencies and other stakeholders move in unison to achieve the goals set out in the PPAN. Focusing on the first 1,000 days of life is one of the strategic thrusts for nutrition action of PPAN 2017 to 2022.
The nutrition-specific programs are programs that address the immediate causes of malnutrition, yung lack of food at saka disease. The nutrition-specific programs will have more sustained effects if the more underlying causes of lack of income, lack of access to goods and services are addressed through the nutrition-sensitive programs. Intensified LGU mobilization is actually working closely with the LGU to capacitate them to plan, implement, monitor, and coordinate their local nutrition programs. GDAs are geographically isolated and disadvantaged areas, and IPs are indigenous peoples, and the PPAN wants to make sure that these groups are specifically reached by services. Whatever the LGU does, they should be supported by the adequate policy support coming from the national level.
Kailangan nating maging maparaan sa paglaban sa malnutrition dahil limitado ang ating resources. Ultimately, ito ang mga gusto nating makamit. We want the prevalence of stunting and wasting to significantly improve. Gusto din nating bumaba ang bilang ng mga sanggol at bata na biktima ng micronutrient deficiency. Gusto nating mapababa o kung hindi man ay hindi natataas yung prevalence ng overweight at obesity. If we achieve these goals, we contribute to the improvement of the quality of our human resource base. We also reduce inequality and we also reduce maternal and child mortality. These are the measures that we need to live up to for us to be able to say that PPAN 2017-2022 is a success. Patuloy tayong makipagtulungan sa iba't ibang sektor para labanan ang malnutrition. And the Secretariat will make sure that the PPAN will be implemented.
Sama-sama nating itama ang nutrisyon ng mga Pilipino. Sama-sama nating suportahan ang Philippine Plan of Action for Nutrition.